WoundClot is ideal for any type of knife injury. Now we put WoundClot into our public access bleed kits, our personal bleed kits, because it's very versatile. Unlike other types of haemostatic agent, which you can only really pack wounds with. So for something that's a real massive hole and you can actually physically pack the product in, they're great. Whereas WoundClot, you can pack a wound with it, but also you can apply it onto the surface. So if you look at a knife crime injury, now this is one example where a knife has gone straight into the body. Now remember, if you have a knife into the body, you would never remove the knife, because as the knife enters, it's done a lot of damage. But while it's in there, it might be just running on the edge of an artery, it might be on the edge of a vital organ or a vein, and by leaving it there, you're not doing any more damage. Now, if you remove it, that may well finally just cut into the artery or whatever the item is there that could cause more damage, or open up that wound even more. So always leave it in there. So from a first aid point of view, we need to primarily stop the bleed, but also stabilize it. So in something like this with a wound here, you can just take the WoundClot and you can tear a piece and apply it on either side. Now this is a mannequin, so obviously you would remove the clothing on here, but just to show. So here we could literally just cut a piece on one side and then lay it across here and across here. So using standard WoundClot, just here I'm just using some training gauze just to demonstrate this. But if we just take it, as you can see, it's very easy to tear. So literally we can pre-tear an item. You could leave it open and then apply it on either side. So that will just literally go over the wound, and it will react very quickly with the blood. So it forms a gel-like plug over the actual cut. So by applying that over there, you've got your WoundClot on, which is straight away going to help on controlling the bleeding, creating this clot, and also stopping any more bleed coming through. Once you've got that on, what you can then do is roll up 2 conventional dressings and put them on either side and bandage that in place in order to keep that still. If an injury is like this with a knife, you must make sure the patient doesn't move, because again, them moving could cause even more damage. So we can stabilize it, and either we could just literally hold that with our gloved hands over the dressing. And the advantage there is you've got a product on to stop the bleed, and also you're keeping pressure on and also keeping the knife exactly where it needs to be. So this is how you could do knife crime in this example, but a lot of the problem with knife crime isn't where the knife's left in. Often people will literally stab or they'll slash someone. So that's where you get more problems. So yeah, there's different sizes. Common ones in bleed kits can be the 10 centimeter by 10 centimeter, which is pretty much what we've used there. And this one's the 8 centimeter by 20 centimeter. So we just open this up, little nicks in the corner, literally just tear it, and you can tear the packet open very, very easily. Remove the WoundClot out of the packet, and then you can unfold it. So looks like different to the training one there. This is the shape of it. But the advantage you've got here is you can literally just tear this and put it onto different areas. So imagine there was a large slash wound on the arm. You could literally cover that over directly onto the wound itself. If there was a really long area you need to do it, you can again tear it, so you can cut it to exactly the shape of the wound. So although you've got one product here, it's very versatile to use in different types of injury. If you don't have this size, you just have the 10 by 10 or a couple of those, you can again patch those up and make them work over the cut itself. Or maybe you have got the Z-fold version, the 8 by 100, and you could cover it over a lot of cuts with one product. So very, very simple and easy to use. The other thing with WoundClot is you don't have to apply direct pressure to make it work. Now we'll cover this in another video, but the whole point of this is that it can be used. Now one thing we've used with bleed kits, and we do a lot of talking, is imagine maybe a 14-year-old girl is trying to help her 14-year-old friend. Now she may know first aid or she may know nothing about first aid. To get her to apply the pressure necessary and to inflict the amount of pain she's going to on her friend, she might be really scared about that and a bit apprehensive about it. The advantage of WoundClot is you put it on and it will still react even without direct pressure. So it makes this having WoundClot in a bleed kit far more effective than any other product out there.